Okay, so tonight I've been called to a 76-year-old male who is suffering from a nosebleed, epistaxis, for the past hour. So I arrive on scene, the patient's sitting upright and he's holding his nose. I do a full set of obs on him, all his obs are normal. He's been suffering from recurrent nosebleeds with warm temperature. I go through all my sample OPQRSTs and zero pain. And there's nothing else, like his hydration status is fine. So I've estimated that he's lost about 200 mils of blood through his nose and into clots and stuff. So I've got him to hold on his nose and compress that for 15 minutes. After that, the nose is still bleeding. So I've talked through him the procedure of IN adrenaline administration to stop his nosebleed. We give the adrenaline for its vasoconstriction effects to stop the bleeding. Okay, so now that I've got my patient all ready and explained what I'm going to do, I'm now going to draw up all my stuff. So here I've got an adrenaline ampule. It's naloxone, but we couldn't find any adrenaline. So I'm going to get this drug checked by my offsider to make sure that this is exactly the drug that I'm going to be administering and its expiry date and everything. I've got a 10 ml syringe and some fluid, and we've got drawing up needle here. So first of all, I'm going to draw up my fluids. Because the patient's bleeding is moderate to severe, the patient's going to need to go see their GP or doctor within 2 hours if the bleeding stops. If it doesn't stop, we need to take them to a GP service. Okay, so we've got that drawn up. I'm going to get rid of the ear and make sure I have 9 ml solution. Making sure that we're in a sterile environment as well and everything's clean and nice and tidy. So crack my ampule. So once I've drawn this up, I'm going to give 2 ml of the solution to the patient in each nostril. After that, we'll be compressing on the nostril for a further 15 minutes. Okay, so get rid of the ear and attach my MAD. Okay, so now I've got my patient ready. He's blown out the clot from his nose and prepared himself, and he's leant his head back so that it's all ready to go. And we'll just block one, and as I push it in, can you please sniff through your nostril? So there we go, that's 2 ml, and then we do the other nostril, 2 ml. Sweet. So I'll get them to compress his nose for 15 minutes, and then we'll come back and assess whether the bleeding is stopped or not. So today I've been called to a 50-year-old male complaining of back pain. So we get on scene and we do a quick set of full vitals, and we also do an assessment as well. So we ask about our sample and OPQRST. So it comes back that our pain is exactly the same as normally. However, he's been lifting heavy objects today and it's now 6 out of 10 as opposed to 3 out of 10 in a localized lumbar area. He states that it also feels the same as well. He suffers from chronic back pain. So we've also asked him about his medical history. He has no relevant medical history or allergies. He usually takes paracetamol and ibuprofen for the pain, which usually manages. However, he took that tonight and it's just not dealing with the pain, so he's called the ambulance. Okay, so now I'm going to do a physical examination. Is that okay,
Yep.
Gabriel?
Yep.
So how have your bowels and bladder been? Is that all normal? You haven't had any changes with that?
It's been all normal, yep.
And you've been well the last few days? You haven't been sick at all?
Yep.
No? Okay, sweet. So if you don't mind, can I get you to roll over just so you're facing the wall there, just on your side,
Yeah,
and
sure.
I'll have a look at your back. So I'm exposing the back, looking for any redness, any changes to that, any rashes or anything like that. I'm just going to have a feel, okay? So you let me know if anything hurts more than usual.
Okay, so it's around about there.
Yeah, there's a bit more pain down here.
Yep.
What about down here? Anything?
No,
Pain down there?
it's just in that
on
one
the side.
spot.
And just down the sides as well. Any pain up here?
No. A bit down there, yeah.
Pain there. What about up here?
No.
And if I just check on the sides, any pain down there?
No.
Just checking the kidneys as well. Any pain through there?
No.
Okay. Do you have any referred chest pain at all? You can lie back on your stomach.
No, I don't.
No chest pain. You haven't been coughing or anything recently?
No.
And I also have a look at the stomach as well for any referred pain.
Okay.
Any pain?
No, that's all good.
Okay, cool. Also looking for any rashes or anything as well. No referred pain. So now I'm just going to make my way down the legs as well, just have a look for any signs of more serious spinal injury. So if I feel down the legs, does that hurt at all?
No.
Any pain down there?
No.
Okay, I'll also get you to push against my hands.
Yep.
And pull.
Yep.
And having a look for any colours, changes in the colour of his feet or temperature of each foot as well. Okay, can I get you to lift your knee up?
Like that?
Yep, and the other one?
Yep.
Does that hurt at all?
No.
Have you had any trouble walking around
No.
at the moment?
Pretty good.
Okay. If you don't mind, can I get you to stand up and we'll just have a look and see for any changes in your gait or anything like that. So if you don't mind, can you just have a walk to me?
Yep.
How do you feel on your feet? Does that hurt at all?
It hurts a little bit, but not too much.
Okay. Perfect. So I've seen my patient mobilise, which is part of my R35 checklist as well. So at the moment, your pain looks relatively the same as normal. Would you agree?
Yep.
It's just a bit more painful today after your heavy lifting.
Yeah.
So if you don't mind, I would like to give you a bit more pain relief. How do you feel about that?
Okay, yeah, that's good.
Okay. So because you've already taken your paracetamol and ibuprofen in the last 4 hours, I'm not going to give you any more of that.
Yep.
But I can give you some tramadol. Have you ever had that before?
Yeah.
And you didn't have any allergic reactions to that? You've got no
Okay.
allergies?
Yep.
Okay, so I'll give you the 50 mg of tramadol.
Yep. Okay.
There you go. Cool. So now that I've done all my assessment, I'm going to have a look through my red flags to have a look for anything. Because your pain is worse today, I'm going to tell you that it's probably best to go to your GP and get it checked out as well if the pain persists or gets any worse.
Okay.
If it goes away in the morning, then that's okay. But I'll just have a look through my checklist to see if anything goes up. So he stated he hasn't had any loss of bladder or bowel control. He is afebrile. Have you experienced any rigours at night or anything?
No.
No rigours during the day. All his vital signs are normal. There's no pain in his thoracic spine or chest. No abdominal pain or tenderness. He has no altered sensation in the saddle area. He has no altered sensation or power in both his legs. He's able to walk. He has no signs of general illness and no pain radiating down his legs. He also, looking at the oranges, has no history of cancer. He's not immunocompromised. There's no pain, especially when he's lying down. Worsening pain when he's lying down. You haven't experienced any weight loss in the last few days, have you? And there's no altered sensation, pain, osteoporosis, or IV drug use. So at the moment, I'm happy to leave you at home. I just have to sort through my paperwork to make sure that this is all okay. Are you happy to stay at home?
Yep.
If this gets worse, call the ambulance back or go see your GP.
Okay. Sounds good.
Brilliant. So today we've been called to a 25-year-old male who suffers from recurrent migraines. He's just noticed that he's had an increased frequency of migraines over the last few days. He's experienced some stress at work and believes that this has increased the occurrence of his migraines. So today he's had a migraine for about an hour now that was preceded by his normal aura. He states that it's all his normal migraine symptoms, and it's about 6 out of 10 pain, unilateral, and it's constant. So I performed a sample test and also did a full set of vitals, all vitals within normal means, and the sample history produced that he's got no allergies, no other medical history that's relevant, just the migraines, and he hasn't done anything out of the ordinary. He's on medication like ibuprofen and paracetamol to manage the pain. However, it's not quite cutting it today, and he needs some extra pain relief. So I'm going to go through a full physical assessment. I've gained consent from him as well. So I've tested his fast, and he has a negative fast test, and he's systemically well with all vital signs normal. Okay, so Gabriel's consented to doing the physical assessment now. Are you comfortable sitting where you are?
Yeah.
Is it okay if I just have a physical assessment?
Yeah.
Okay, cool. So, how have you been over the last few days? Have you been well?
Yeah, I've been well apart from this.
Apart from the just increased frequency of headaches?
Yep.
Yeah. And you haven't had any coughs, colds? Nothing like that? Yeah. And did you have any trauma before the headache started, or was it just normal,
Nah,
your normal aura?
Yeah.
You haven't noticed any funny smells or anything recently?
No.
Any funny sounds? Everything sounds normal as well?
Yeah.
Tastes all normal?
Yep.
Okay, cool. You don't have any pain in your neck at all?
No.
What about down in your chest? Any chest
No,
pain?
definitely not.
That? Okay, and if you move your head to the sides, any
Yep.
pain when you move it around?
No. No pain.
And forward and back?
Yeah, no pain.
That's all normal. Okay, sweet. Can you give me a big smile? And can you squeeze my hands?
Yep.
Okay, sweet. And just hold your hands out and close your eyes. Okay, that's cool. I'm just going to have a look in you.
Yep.
Just look at my nose. You have no family history of intracranial bleeds or anything like that? Or any personal
No.
history?
No.
Okay, that's all normal. Okay, I'm just going to have a feel around your head and stuff.
Yep.
Any pain when I'm touching?
No.
Around the forehead?
No.
Any pain?
Mm-mm.
Okay. Can you stick your tongue out for me? Can you lift it up? And lift it down? Side to side? Okay, sweet. Can you give a big grimace on your face? Okay, and he's speaking quite normally and quite fluently to me as well. So I'm quite happy that there's nothing else abnormal going on with this headache.
Mm-hmm.
It is just an increased frequency of your normal migraines. Would that be correct?
Yeah, I
That you're
think so.
feeling? Yeah. Okay. So I'm quite happy to leave you at home, but I want you to go to the GP and just go get it checked out because you have had this increase in frequency.
Yeah.
And just figure out where that's going. So if you could do that within the next 24 hours, that would be perfect.
Okay.
So I'm just going to go run through my checklist as well, just to make sure that there's no human error and I've forgotten anything.
Mm-hmm.
So he has no headache or neck pain following manipulation. There's no neck pain or stiffness. His headache was not sudden in onset. It was his normal migraine followed preceded by aura. He's afebrile. He's had no vomiting or nausea. There's no focal neurological signs, and he has quite a normal level of consciousness as well. He's had no recent trauma. He's not on anticoagulants. No signs of temporal arteriitis. He's not pregnant. No history of intracranial bleeding or family history of cerebral vascular abnormalities. And the onset was not during sexual activity. So I'm quite happy that he passes all of these red flags and that we're going to leave him at home. But before we do that, we're just going to give you a bit of pain relief because it is still a 6 out of 10.
Yeah.
And that paracetamol, ibuprofen hasn't worked. Are you happy to have some tramadol?
Yeah.
Have you ever had that before?
Yeah, I have.
And any
No,
adverse reactions?
No, it works pretty well.
You have no allergies to any other drugs?
Not that I know of.
Okay, sweet. So I'm going to give you this tramadol.
Yep.
Just 50 mg. Okay. So you know if anything gets worse, you can call us straight back, or if the headache comes back again and you feel like you need to call us, do so.
Okay, sounds good.
Cool. Thank you. Okay, so today I've been called to a 20-year-old male that's been playing rugby. He was tackled and ended up getting tackled on his knee and did a twisting motion. He felt a bit of a pop, a bit of a crepitus, but he's not really sure. So they're taking him to the sideline where we found him. So I've done a full set of vitals and all his vital signs are normal. I've done a good secondary survey, had a look at his lungs and head injury and looking for any of that C-sign tenderness, and it's all clear. It looks like it's just an isolated knee injury. So from that he's allowed me to do a physical assessment as well. But through my sample he's got no allergies, he's got no previous medical history of anything, he's not on any medications, it's just this isolated knee injury. Okay, so I'm about to do my physical examination. I've gained consent from my patient, that's all good. If I have a look at your knee, we'll try to figure out what's going on with it. So having a general look at the knee, comparing it to the other one as well, I'm looking for any growth signs of redness, swelling, any bruising, obvious deformity, anything like that. So on my patient I noticed there's a little bit more swelling. So I want to figure out when the swelling came on and how fast. So when did this start?
The injury was about half an hour ago, and it's just been quite gradual.
Oh, it's been quite gradual, because with fast swelling you can look at stuff like bleeding into the joints and stuff. So I'm having a look up the leg and stuff. Is there any pain up there?
No.
Any pain down here at all?
No.
So it's just in this
Just
one
in the
spot.
main,
Okay. So I'm going to come down and have a look at his lung baselines, take his socks off, have a look. So I'm looking at the colour of the 2 feet, see if they're still the same. They seem relatively the same. Their capillary reflow is the same and the same temperature. Have a look, and they've got the same pulse as well. So I'm going to have a feel of the knee. Is that okay?
Yeah, that's fine.
So if I come up here, does that hurt around here?
Yeah, it does actually, yeah.
So he's got a bit of tenderness around his fibula. Have you been able to weight bear at all?
I haven't really tried, but I don't think I can.
Okay, so
It's quite
inability
sore,
to weight bear. And how about if I'm pressing around here?
That's quite tender. Yeah.
That's quite tender. So I'm thinking at this stage, just from what I've done right now, we're probably going to need to go get an x-ray as well.
Yeah.
But I'll keep my assessment going as well.
Okay.
So moving around the patella, does that hurt at all?
It hurts, but
It appears intact.
Okay.
And it seems okay. So do you think I'll be able to bend your leg up?
Yeah.
If you just relax?
Should be okay. Yeah.
Tell me if
It'll be
it's
sore.
too much pain.
Yeah, it's quite sore, but not too much.
But that's okay?
Yeah.
Okay. So I'm going to apply a bit of pressure here
Yeah. That's quite sore.
and there.
Yeah.
Okay, cool. I'm now going to do the McMurray's test.
Okay.
Is that okay?
Yeah.
I'm just going to rotate.
Yeah, that's quite sore
Yeah.
there.
Okay. And I'm feeling quite a bit of crepitus and popping, so I'm just going to place that down as well. So that's a failed McMurray test.
Cool.
Okay, cool. So what I'm going to do right now is I'm going to ask if you want to go to hospital. How do you feel? Because I feel that you need to go get an X-ray and get it checked out.
If you think I should, then I should.
Yeah, okay, so I recommended you go to hospital, so you can come along with us.
Yep.
And en route, I'm just going to do some more vitals, make sure that he's okay, and we'll get on top of his pain as well. So what kind of pain are you in? 10 being the worst pain?
It's probably about a 6.
About a 6 out of 10, cool. So I'm going to look at some oral paracetamol, some paracetamol, ibuprofen, tramadol. Have you had those before?
Yeah.
Yeah, and they're all good?
Yeah.
Okay, sweet. So we'll give him that en route and also look at some Internox as well, just to help with the pain. If that's still not managing the pain, we can look at getting back up with something a little bit stronger, but I think we'll manage with this pain at the moment.
Okay.
Fucking that's done.
Yeah. That's PBH.